you. Oh, wonderful. Great day. Thank you very much. Thank you.
Good afternoon. I'm Dr. Susan Blumenthal, Assistant Surgeon General, and I'm honored to welcome all of you here today. We want to especially acknowledge Dr. Anna Meadows, the newly appointed Director of the Office of Cancer Survivorship at the National Cancer Institute, Fran Visco, President of the National Breast Cancer Coalition, with whom I have the privilege to serve as co-chairs of the National Action Plan on Breast Cancer, Elizabeth Clark, Executive Director of the National Coalition for Cancer Survivorship, Dr. Marianne Alciati of the U.S. Public Health Services Office on Women's Health, who serves as the coordinator of the National Action Plan on Breast Cancer, and Ellen Siegel, Chair of Friends of Cancer Research. As many as 40% of Americans will develop cancer in their lifetimes. So all of us here today have at least one thing in common. Our lives have been touched by cancer. 20 years ago, my mother died of breast cancer. She was a child when she was diagnosed with the disease. At that time, we could not say the word cancer out loud, nor could we share her struggle with others. Much has changed since then. The stigma has been shattered, knowledge has been expanded by harvesting and applying new advances from research, which is medicine's field of dreams. And we now have an entire generation of citizens who call themselves cancer survivors. And this progress could not have happened without the leadership of the people here today, the dedicated and courageous Americans who have survived cancer, who are raising awareness about the disease, and those of you who are working at the laboratory bench, at the clinical bedside, in our federal government, and in our communities. And it couldn't have happened without leaders like Secretary Donna Shalala and President Bill Clinton. On a personal note, let me say, as a woman, as a physician, as the country's first Deputy Assistant Secretary for Women's Health, I am so proud to serve with a president who has made improving the health of American women a top national health priority. Under the leadership of this president, we are writing a new national prescription to improve women's health, putting an end to past inequities. The result is the greatest focus on women's health in the history of our nation, and it is providing hope for a healthier future for all American women. We're dramatically increasing funding for women's health, putting real financial muscle behind our commitment, and we've mobilized all agencies of government to work with us in partnership with the private sector. We are putting women's health issues on the front burner where they belong, from including women in clinical trials, to doing the research needed to develop new treatments and prevention strategies for diseases that affect women, to transferring defense and space technologies used to spot missiles 20,000 miles away in distant skies and to see the surface of Mars, to improve the early detection of cancer in women, to empowering women to make smart health choices, to ensuring that today's healthcare professionals are trained to address women's health needs. And we're waging an all-out assault on breast cancer, with the National Action Plan as a key element established by the President, which is helping us fight breast cancer on many fronts by increasing research, improving service delivery, and enhancing public policy and education. And this couldn't have happened without heroines like Jane Reese Colburn. By the time Jane discovered her cancer, she was told that it was inoperable. But she would not, she could not, and she did not give up. She kept on fighting. She kept on fighting every day, fighting through the chemotherapy, fighting through the radiation, fighting through tamoxifen treatments. And armed with two very powerful weapons, great science and unyielding personal courage, she is winning the battle. Today, She is inspiring others to do the same. She is the Executive Vice President of the National Breast Cancer Coalition, a member of the Steering Committee of the National Action Plan on Breast Cancer, and a full-time activist and advocate who is fighting for the day when our nation's children will have to turn to the history books to learn that there ever was a disease called cancer. She's an inspiration to us all. I am very proud to introduce to you Jane Reese Colburn.
As Susan mentioned, when I was 36 years old, I was diagnosed with advanced inoperable breast cancer. And truly, it's every woman's nightmare. And my search to find the most aggressive treatment took me to the government, to a clinical trial at the National Cancer Institute. And after 8 rounds of very high-dose chemo and a lot of illness, my cancer completely disappeared. I then took 8 weeks of high-dose radiation, and I'm pleased to say that I'm now 6 years out and I'm disease-free. These are some of the remarkable results that can be achieved when we invest our tax dollars in breast cancer research. But research is not enough, and despite many advances, we still don't know how to prevent or cure many cancers, and breast cancer is among them. Too many of my friends in the clinical trial died of breast cancer. As Executive Vice President of the National Breast Cancer Coalition, I've had the privilege of working with this administration to accomplish some amazing things. We've increased breast cancer research funding from $90 million to over $500 million, created a new innovative breast cancer research program in the Department of the Army, and in response to our 1993 signature campaign, the President committed to a national action plan on breast cancer, a public-private partnership. President Clinton knows the horrors of this disease. Firsthand, he lost his mother to breast cancer. He continues to be a tireless supporter of breast cancer issues, but there are still many, many unanswered questions, many that still need to be addressed. We are looking forward to continuing to work with the President on issues such as genetic discrimination, real health care reform, so all women and their families can have access to quality care, to Medicare coverage of patient costs in clinical trials, and of course, finding the necessary research dollars to find the answer to not just breast cancer, but to all cancers. We do not for one moment doubt the President's commitment. So it is my privilege to introduce our partner in fighting breast cancer, President Bill Clinton.
Thank you very much. Thank you. Thank you. Thank you so much. Thank you. First of all, thank you all for joining me on this beautiful, beautiful Sunday afternoon to discuss our common efforts to fight cancer. I want to thank Secretary Shalala and Dr. Susan Blumenthal for their tireless service on behalf of women throughout America. I thank Dr. Harold Varmus, the Director of the National Institute of Health, Dr. Richard Klausner, the Director of the National Cancer Institute, and Dr. Stephen Joseph, the Assistant Secretary of Defense for Health. They have all been instrumental in the efforts we are here to talk about today. And thank you, Jane Reese Colburn, for your courage, your dedication, your willingness to come up here and make a public statement today that represents the feelings, the convictions, the interests, and the hopes of millions and millions of people throughout the United States. Let me thank all the survivors and advocates who are here today and who fight the battle against cancer every day for all the rest of us. Our nation is only as strong as our families are healthy. I have devoted a lot of time and thought to the question of what we need to do to help strong families survive and thrive and increase as we move into the 21st century. We have to help more people succeed at home and at work. But clearly we have to help people live as long and as well as they can, and then help families have the support they need when their family members are ill. That's why I was glad to sign the Kennedy-Castlebaum bill to preserve health insurance options for people when a family member's been sick. Why I was proud to sign the bill that bans insurance companies for forcing mothers and their newborn babies out of the hospital after 24 hours, why in our new balanced budget there are funds for more regular mammograms for women on Medicare, and funds to give respite care for families who are caring for members with Alzheimer's. We have an enormous opportunity as we stand on the brink of this new century to take advantage of scientific possibilities, to help people live as long as well as they can, and to build stronger families in the process. Nothing is more devastating to a family's strength than when someone is diagnosed with a life-threatening disease like cancer. As Jane said, I know about this from my own family's experience, and nearly every family does. This year alone, nearly 1.4 million American men, women, and children will be diagnosed with some kind of cancer. This is the 25th anniversary of the National Cancer Act, and in those 25 years, we've come a long way in the fight. This month is also Breast Cancer Awareness Month, a time to remember the terrible toll breast cancer has taken, to assess our progress, to redouble our efforts to find a cure. That's why I wanted us to come together today to talk about the new steps we are taking in the fight against cancer, and breast cancer in particular. Since I took office, we have mounted a comprehensive campaign to prevent and treat cancer. We are working to get tobacco out of our children's lives forever. We have accelerated FDA approval of cancer drugs and made it easier for patients to obtain promising therapies before they are formally approved. The Department of Health and Human Services, the Department of Defense, NASA, and the CIA have all joined forces to develop cutting-edge imaging technology for the early detection of cancer. Most important of all, as has been said, we've increased spending on cancer research, treatment, and prevention by some $400 million. In the battle against breast cancer, we've increased funding for research and prevention by nearly 80% since 1993. We launched a public awareness campaign to encourage older women to use Medicare to have mammograms. And my balanced budget goes even further, as I said. It will guarantee free annual mammograms to Medicare beneficiaries, removing all financial barriers that prevent some women from obtaining this vitally important test. We are making progress. The survival rate has gone up. 7 out of 10 children with cancer survive it. That's up from 1 out of 10 just 25 years ago. The death rate for breast cancer has gone down every year in the last 7, has dropped by nearly 8% since 1990. Just last week, the NIH announced a milestone in the Human Genome Project, which is identifying the location and function of nearly every human gene. We've now mapped out 20% of all human genes, and anyone can use that map on the internet. Soon we will know the genes that contribute to cancer and our genetic predisposition to inherit it, and possibly then be able to prevent it before it strikes. But as far as we have come, we still have far to go. We must continue to build on our progress and strengthen our efforts. Today, I announced 3 new steps to bring us closer to a cure and to improve the lives of those who do survive. First, we know that genetic research may be the key to understanding and curing breast cancer. In the last 2 years, scientists have discovered 2 genes that indicate susceptibility to breast cancer. This remarkable discovery is giving hope to women everywhere. Last month, I signed a budget that reflects our values in devoting substantial resources to cancer research. Today, I'm announcing we are directing $30 million of that new budget to support and expand breast cancer genetic research at hospitals, universities, and labs all across America. This step represents a major increase in breast cancer genetic research. It will ensure the development of this promising new research and bring us that much closer to a cure. Second, we must all use the technology, and we must use all the technology at our disposal to give women the information they need about breast cancer. We must unite the forces of the public and private sectors to achieve that goal. That's why I'm pleased to announce the launch of the new National Action Plan on Breast Cancer website on the internet. This is easily accessible. The website address is right over there. It will answer the questions women have about early detection, clinical trials, and much more. And finally, there's no greater proof of the progress we've made than the more than 10 million Americans who have survived cancer. Many have special psychological, physical, and health care counseling needs that we are only beginning to understand. Some face recurrence of their illness. Some can't get health insurance. I'm proud to have passed landmark legislation to guarantee that cancer survivors will no longer live in fear of losing that health insurance just because they have a pre-existing condition. Today, I announce that this Friday, November 1st, the National Cancer Institute will open its new Office of Cancer Survivorship. The office will support much-needed research that will help cancer survivors deal with the problems they face even after their cancer is cured. Dr. Anna Meadows will be the director of the Office of Cancer Survivorship, and I thank her for her willingness to do this groundbreaking service on behalf of people with cancer who have survived it all across America. These steps help us to put science at the service of our families and say we will do whatever it takes to continue the fight until there is a cure for cancer. And we will do everything we can to improve the lives of those who do survive. Just a few moments ago, I signed a piece of the Ribbon of Hope. This yellow ribbon, which is already over 750 feet long in its entirety, has been signed by more than 10,000 cancer survivors around the world. The First Lady was the first person to sign the ribbon, and I was honored to place my own signature alongside that of so many courageous people. The ribbon is a symbol of the hope that sustains people in their struggle with cancer. It is also a symbol of the progress we have made and the progress still to come in our common fight. And now I'd like to present that piece of the Ribbon of Hope that I signed to Erin Schreibman, herself a cancer survivor, a very brave young girl whom I have very much enjoyed meeting today. Thank you, and God bless you all. We're adjourned. Stand up.